Do you ever cover your mouth when you laugh? Do you avoid ordering steak or corn on the cob because you are afraid your dentures might slip or your teeth might hurt? If you are living with missing teeth, you are dealing with more than just a cosmetic issue. You are facing a silent crisis that affects your digestion, your speech, your self-esteem, and most dangerously, the structural integrity of your jawbone. You have likely searched for dental implants and felt overwhelmed by the jargon, the high price tags, and the fear of surgery. Is the procedure painful? What happens if you don't have enough bone? What is the difference between a zirconia crown and a metal one? And is the cost of dental implants really worth it compared to a bridge or dentures? Welcome to the most comprehensive guide to dental implants available today. We are going to bypass the marketing fluff and give you the raw medical truth about tooth replacement. We will cover the step-by-step surgical procedure, the reality of bone grafting and sinus lifts, the full mouth all-on-4 restoration, and the crucial recovery timeline. By the end of this video, you will have the knowledge of a dental professional, empowering you to make the right choice for your health. Let's begin with the fundamental science. What is a dental implant? A dental implant is not the white tooth you see. It is an artificial tooth root. It is a precision-engineered post, typically made from medical-grade titanium, or in some holistic dentistry cases, ceramic zirconia. This post is surgically inserted into the jawbone beneath the gum line. The magic lies in a biological process called osseointegration. This is where your natural bone cells attach themselves directly to the titanium surface, locking the implant in place. This makes it the only tooth replacement option that actually stimulates the jawbone, preventing the bone loss and facial collapse that inevitably happens with dentures. But before you can get an implant, you must pass the candidacy phase. This is where digital treatment planning comes in. Your dentist will take a 3D CBCT scan. Unlike a regular X-ray, this scan shows the width, depth, and density of your bone, as well as the location of nerves and sinuses. This is the make or break moment. If you have been missing a tooth for years, your bone has likely atrophied or shrunk. This leads us to a massive SEO topic, bone grafting and sinus lifts. If the scan shows you lack sufficient bone volume, you are not disqualified, but you will need a preparatory procedure. A bone graft involves taking bone material, either from another part of your body, a donor, or a synthetic source, and packing it into the area where the bone is thin. This acts as a scaffold for your body to grow new, healthy bone. If you are replacing upper back teeth, the sinus cavity might be too close. In this case, a sinus lift is performed to gently raise the sinus floor and add bone underneath. While these sound intimidating, they are routine procedures for a skilled oral surgeon or periodontist, essential for the long-term success of the dental implant. Now, let's walk through the actual dental implant surgery. This is the day that causes the most anxiety, but let me reassure you, with modern local anesthesia and sedation dentistry options, the procedure itself is painless. You will feel vibration and pressure, but no sharp pain. The surgeon makes a small incision in the gum tissue to expose the bone. Using a series of precision drills, they create a space for the implant. The titanium post is then torqued into place with extreme accuracy. Depending on your specific case, the dentist might place a cover screw and stitch the gum over it to let it heal, or they might place a healing abutment that pokes through the gum. In some rare cases with excellent bone stability, they might even do an immediate load, placing a temporary tooth on the same day. However, for most people, the implant is left to sleep for 3 to 6 months. This waiting period is non-negotiable. You cannot rush biology. If you load the implant too soon, the micro-movements will prevent the bone from fusing, leading to implant failure. We are about to discuss the second phase, the restoration and the costs. But before we do, I have an important favor to ask. We are committed to providing honest, high-quality health education to millions of people. Please hit that subscribe button right now. It helps us create more deep dive content like this. Also, I want to invite you to join the conversation. Go to the comments section and tell me, are you wearing dentures right now? What is your biggest fear about getting implants? Is it the cost or the pain? Write your story down and read the comments of others. You are not alone in this journey. Also, share this video with a friend or a parent who has been complaining about their teeth. This information could change their life. Welcome back. Let's move to the phase 2, the restoration. Once osseointegration is confirmed, usually by an X-ray showing the bone hugging the implant, you return to the dentist. They will attach an abutment. The abutment is the connector. It serves as the base for your new tooth. Your dentist will then take an impression. In modern clinics, this is often done with an intraoral digital scanner, creating a 3D model of your mouth without that messy, gooby putty. This digital file is sent to a dental laboratory where your custom crown is crafted. You have choices here. PFM, or porcelain fused to metal, is strong but can sometimes show a dark line at the gum. Solid zirconia, or EMAX crowns, are incredibly durable and offer the best aesthetics, mimicking the translucency of natural enamel. When the crown is ready, it is either cemented or screwed onto the abutment. The hole is sealed, and suddenly you have a brand new tooth that functions exactly like the one you lost. But what if you're missing all your teeth? Or what if your remaining teeth are failing due to severe periodontal disease? Replacing 14 teeth with 14 individual implants is surgically aggressive and financially impossible for most. Enter the all-on-4 or all-on-6 solution. This is a revolutionary protocol. By placing just 4 or 6 implants at strategic angles in the jaw, specifically tilting the back implants to avoid nerves and sinuses, surgeons can utilize available bone without always needing extensive grafting. This is often marketed as teeth in a day. In this procedure, the bad teeth are extracted, the implants are placed, and a temporary fixed set of teeth is screwed onto the implants all in one appointment. You wake up with a new smile. It is not your final set. You wear the temporary set while the bone heals, but you never have to go without teeth. This fixed bridge does not cover the roof of your mouth like a denture, restoring your ability to taste food and speak clearly. Now, we must address the financial reality, the cost of dental implants. Why is it so expensive? You are paying for the sterilization, the surgical suite, the highly trained staff, the surgeon's expertise, and the premium materials. A cheap implant is a risk you do not want to take. Low-quality titanium can fracture or cause rejection. On average, a single implant with the abutment and crown can range from $3,000 to $6,000. An all-on-4 arch can range from $20,000 to $30,000 per jaw. While this sticker price is high, compare it to the lifetime cost of bridges. A bridge requires cutting down healthy adjacent teeth and often fails after 10 to 15 years, requiring replacement and often leading to the loss of the supporting teeth. A dental implant is a one-time investment that can last a lifetime with proper care. It is cheaper in the long run. Finally, let's talk about maintenance and risks. Do implants get cavities? No, but they can get gum disease. It's called peri-implantitis. If you do not brush and floss around your implant, bacteria can attack the bone holding it in place. If you smoke, your risk of failure skyrockets because smoking restricts blood flow required for healing. If you grind your teeth, you must wear a night guard to protect the porcelain from chipping. In conclusion, dental implant surgery is a marvel of modern medicine. It stops bone loss, restores 99% of your chewing power, and gives you back the confidence to smile in photos again. Whether you need a single tooth replacement or a full mouth reconstruction, the technology is safe, predictable, and life-changing. Thank you for investing your time in this deep dive. Knowledge is the first step to health. If this video helped clarify your options, please like the video and subscribe for more medical insights. Don't forget to check the description for more resources. Take care of your smile. It is the only one you have. And we'll see you in the next video.